Washington State has already administered over 1 million vaccine doses, and we're only at 171,000. In the U.S., they expect to make the vaccine available to everyone by April or May, and Canada's saying by September. So can you understand the frustration British Columbians feel when we see our neighbors just over the border in Washington State get vaccinated much sooner with a promise to return to normal by the spring? Do you share that frustration that Canada has not been able to secure as much vaccine as other countries, thereby delaying our recovery?
I don't know if you can read frustration in my face, but of course we do. It is what it is. It doesn't make vaccine come any quicker to be upset or angry or mad about it. We're dealing the hand that we're playing the hand we were dealt, and we are committed to getting immunizations as fast into people's arms to protect people as we receive them, and we've been doing that very effectively so far. We now are very hopeful that once we've started to get supply on a regular basis, and Pfizer has committed to giving us increased doses between now and the end of March, we're also hopefully going to also receive increased doses from Moderna. And we know that there's more vaccine on the horizon. So come April, we understand that the shipments we're receiving from both of those vaccines will be increasing and moved up from where they were initially thought to be received. So from quarter 3 to quarter 2, where we are expecting. I qualify everything because, as we know, with a large global production like this, there's always snags, whether it's the weather, whether it's the production facility, whether it's access to the supplies that we need, the low dead space syringes, for example. So these are all moving parts that are changing rapidly, and we're trying to adapt as best we can. We will be starting our mass vaccination clinics for our elders and seniors starting in March, and for most of us starting in April. So we'll do what we can with as much vaccine as we receive as soon as we get it, and that's what we're planning for and continue to plan for.
I mean, the short answer is, of course, yes. It would be desirable to get more vaccine every day. Every person that gets vaccinated in BC makes everyone else safer in BC. So we'd like to have more, and as you can tell, the vaccine that we have received, we've delivered into people's arms, and the results in long-term care have meant that since January 15th, we've gone from 49 long-term care assisted living, independent living outbreaks to, I believe, 15 today. So that's shows how effective the vaccine can be, and where we have seen and continue to see new outbreaks, they've been among small numbers of people. So we know the vaccine is effective. We'd like to see more of it. Some of the reasons why there isn't domestic capacity to produce vaccines in Canada are well known. There's a debate about that from our past decisions that were made about this have affected us now. There's no question about that. But as Dr. Henry has said, we have to deal with the situation in front of us, and simply complaining about it is not sufficient. Although, let's be clear, we have to make sure, I think, as a country, and Canada at the national level has to make sure that that this situation is dealt with in the future. But for right now, we have to take the vaccine we can and deliver it in the most effective possible way to protect the most vulnerable first, and then everybody else. Would we like to have more doses? Absolutely. Every single day we think we'd like to have more doses, every week and every month. But we are dealing with those that we have, and I think the folks doing the campaign on the ground who are delivering, especially have delivered immunization in healthcare facilities, are doing an extraordinary job, and we have to recognize their work.